A deadly virus is now spreading rapidly across the United States. To date, we've now seen cases in California, Nevada, Arizona, New Mexico, Colorado, Texas, Iowa, Illinois, and many other states right here at home. And no, this is not connected to any kind of respiratory disease. In fact, this is one that doesn't necessarily have a cure and has a death rate of 60%. It's also quite fitting that we're now hearing this news early in the year. Back in early 2020, you guys remember, we also heard very similar news of a virus that experts predicted would be affecting the entire globe. Hey guys, I just want to thank you so much for always tuning in. If you could, just take a quick second. All I ask is that you drop a quick like for the video. It really means a lot to me, and I want to thank you for always sharing the videos. It totally helps out the channel, but let's get back into it. So it's called Candida Auris, and it's a deadly fungal infection that is now spreading throughout our country. In fact, the warning that we're now getting from doctors all across the country is that while there are no medications for this type of an infection, it's important to remember that the nightmare infection is resistant to drugs. Now, this is very concerning, very alarming to say the least. It's also an infection that spreads very easily in medical facilities. In fact, the first case in Washington was reported back at the start of the year on January 10th. At this point, it's unclear as to what the initial source is as investigations are still underway. It's important for us to know that this was a forewarned alert that we received long ago by the CDC. A press release actually from March last year. It singled out that the infection as it was considered to be a threat to the United States. Well, here we are today, 2024, February. And so the press release also mentioned echinocandins, which is the antifungal medicine that was most recommended for treatments of Candida Auris. The problem is that in 2021, they found out that most cases showed that the infection was now able to resist this medication. And not just that, but it's also been found that it's resistant to multiple antifungal drugs. This had the CDC mark Candida Auris as an urgent global threat, even way back in 2023. The CDC also has data that shows that almost 2,500 cases have been reported within the last 12 months for the United States alone. In fact, the redder the state is, the more cases that have been found. Now, you may be wondering why some states are grayed out, and that's because some of them just kind of haven't provided their data to the CDC yet. Could be really bad. It may not be so bad at all. We have to wait and see. But mostly because the outbreak for COVID-19 at the time was deemed much more important. Now, there are 5 statements that have been released about this particular fungus. So first, it causes serious infections. Next, it often is resistant to many different drugs. Third is that it's now becoming more common. As we see from the map, we can see that it's kind of spreading rather quickly here. Fourth is that it's difficult to identify. And lastly, it can spread and cause an outbreak, much like what we saw with the health crisis. Now, it also shares another very similar trait to that of the last crisis that we had. Many people who get this fungus won't necessarily show symptoms at all. So yes, they're asymptomatic. The problem there is that about 5 to maybe 10% of those people develop invasive infections, with about 45% of them dying within 30 days. So, like I said, it spreads easily through healthcare facilities. So that would be hospitals, that would be clinics, things like that. The problem there is that it's also possible to already be sick and not even know it. Worst yet is that they go to a hospital for a completely different concern and spread the fungus from then on. And then, of course, people who work there spread it with every person who comes in for care. This is being confirmed by the CDC by going through the numbers. In 2019, we had fewer than 500 cases nationwide of Candida Auris. By 2022, that number ballooned to around 2,400. But what can happen if you get it, right? Well, it can just cause ear infections, maybe wound infections, urinary tract infections, blood infections that spread to the rest of the body. Now, of course, there are those who show symptoms like fever, chills, extreme tiredness, low blood pressure, ear pain, low body temperature, and high heart rate. The way that this fungus can spread is also quite tricky though, especially when you take into consideration just how easy it could actually get into a controlled area. Very similar to what we were told within the health crisis, Candida Auris, it can spread through contaminated surfaces, clothing, or shared medical equipment. An example that they gave was the blood pressure cuffs that you kind of wrap on your arms and they go like that. Anyway, so it's worth noting that it's estimated that this particular fungus can survive on surfaces for several weeks. That alone is cause for major concerns.
Officials are putting out warnings about an emerging fungus. It's called Candida Auris, and the CDC says it, quote, presents a serious global health threat. So what is it and who's at risk? Let's verify with the help of these sources, including the CDC and the Virginia Department of Health. Candida auris is a type of yeast that can cause severe illness in hospitalized patients. It can infect multiple parts of the body, including ears, wounds, and the bloodstream, and the symptoms vary. The fungus is also hard to identify with normal lab techniques, so it's tricky to track, but the number of cases is growing. It's also often resistant to multiple antifungal drugs. People with weakened immune systems or who've been hospitalized for long periods seem to be most at risk. Even with the resistance, though, our experts say there are drugs that work against the fungus, and with proper PPE and cleaning, hospitals can keep it from spreading. Plus, the fungus can be harmless for many healthy people, colonizing the skin without causing infection. So for most of us, there's not much to worry about.
However, there is a silver lining, or at least one that seems like one. So the CDC did confirm that healthy individuals don't get serious infection from it. So if you're in good physical shape and you're not sick, there's a very good chance that you don't get too affected by this, even if you are carrying it. But that also poses a risk for people around you. So the risk is that for people who may be patients that have long stays in hospitals and need medical interventions like breathing tubes, feeding tubes, or urinary catheters, taking into consideration again that there's no specific cure for this thing and that it does have a death rate of approximately 60%. This is rather alarming. Infecting people that may already be sick could prove to be incredibly fatal. So we need to be careful. In fact, the concern from health professionals now is that more and more Americans are now living a normal life. So what exactly does that mean, right? Well, it means that less people are wearing masks. And the same could be said for social distancing, even physical touch. We're now at a point where most of us feel as if things are kind of back to normal. But just like I said a second ago, cases are now showing in places that we've never seen them before. Washington State, for example, they just had their first known outbreak of the fungus. And with everything that we've discussed when it comes to how fast this thing can spread, there's a high chance that more cases will actually be found. Now, the scariest part in Washington is that 3 of the 4 infected people were actually tested for Candida auris. The initial results were negative, but after some time, they became aware that all of them contracted the virus, even though none of them were initially showing symptoms. This is concerning. So does it mean that it can spread throughout the country in 2024? Well, there is a high chance that it does happen. However, we should also expect data to pick up just a little bit more, given that states are probably reporting cases as we speak. So we'll definitely keep an eye on those. Now, you might be wondering as to what steps that you can take in order to try to avoid this thing, right? Well, given by the facts that we know, there's really no best way to avoid it other than, being in good shape health-wise, washing our hands, that kind of thing. Any patient who gets Candida auris gets treated very similarly to how hospitals and clinics treated people who had the COVID-19 virus. So yes, hand washing is one essential thing that health experts call for when dealing with this thing, but still, there's a good chance that patients recover if special precautions are taken in order to help them get better. Obviously, this is not exactly going to be solving the problem, even after Candida auris is treated. Patients may continue to have on their skin or other parts of the body that doesn't necessarily cause an infection or illness, but there's still a chance that it could spread to other patients, so we definitely have to be careful. As of now, we know that the CDC is closely monitoring this thing and they're staying on top of cases that continue to spread out throughout different states. So as always, I'm going to do my best to keep you guys informed and in the know. But before I go, I just want to thank you guys for hanging out. Thanks for always hitting the like button. Thank you for subscribing, and I'll see you on the next one.